So, hello everyone. Thank you for your patience. My name is Stacy Cruz. I am the Strategic Programs Manager here at Fear Free, and I'll be your webinar host tonight. Thank you for joining us for helping new pet owners create a fear-free and happy life for their pet, brought to you by Vetoquinol. And presenting today will be Dr. Ken Martin and Debbie Martin. Dr. Martin is a diplomat of the American College of Veterinary Behaviorists and a licensed practicing veterinarian in Texas. He graduated from Louisiana State University School of Veterinary Medicine in '99 and completed a clinical behavioral medicine residency at Purdue University's Animal Behavior Clinic in 2004. Dr. Martin is the owner of Veterinary Behavior Consultations in Spicewood, Texas, and regularly consults with veterinarians and pet owners on behavior and training. He's an international lecturer on animal behavior disorders and training, and he teaches a small animal behavior course for veterinary students at Louisiana State University School of Veterinary Medicine. Debbie is a licensed veterinary technician and a veterinary technician specialist in behavior. She's been a full-time registered licensed veterinary technician since '96 and worked in private practice for 14 years. Since 2005, Debbie has been the animal behavior technician for veterinary behavior consultations. And Debbie and Dr. Martin are the co-owners of Team Education and Animal Behavior. They are both fear-free certified elite professionals and are subject matter experts for fear-free. We are so very excited to have them with us today. So just a quick housekeeping note before we begin. For all of you logged in on your computer, there should be two options on your Zoom controls. So there will be a chat feature as well as a Q&A feature. We will have time at the end to address questions from the audience. So if you do have a question that you want the Martins to answer live here, please use the Q&A box so I can keep track of it and not lose it in the open audience chat. So we are so excited to have the Martins here with us today. And on that note, I will pass it over to you and we can go ahead and get started.
Great. Well, welcome, Fear-Free Certified Professionals. Debbie and I are thrilled to be here. And we're happy to talk to you about helping new pet owners create a fear-free, happy life for their pets. Now, you as fear-free certified professionals are really the experts in addressing the mental health as well as the physical health of our clients, patients, our pets out there, in the world. But it can be difficult with all that knowledge that you have, how in a limited amount of time to give your client the information and the tips that they need to make the pet's life fear-free. And then oftentimes pet owners can be overwhelmed with, we give them so much information, right? We have this vast knowledge base, but we give it to them in a short period of time, and they can only absorb so much information in that limited period of time. Well, fortunately today, Debbie and I are going to give you 5 tips for improving the lives of pets and starting off the relationship really on the right paw. And our really goal today is to strengthen the human-animal bond, to keep pets in their home. Unfortunately, more pets lose their lives due to behavioral problems and all the other combined issues. And also, we want to keep pets and their people coming back to your establishment. So tip number 1, we need to teach pet owners how to recognize body language that's indicative of a relaxed pet or a stressed pet. Now, dogs and cats, they're excellent communicators. And as fear-free certified professionals, you should be aware of how to tell a stressed pet from an actual relaxed pet or a comfortable pet in that context or in that situation. But the unfortunate thing is that a lot of pet owners, they don't necessarily recognize what a stressed pet is or what a relaxed pet is. It's common for dogs and cats not to like to go to the veterinarian, not to like to go to the groomer, or not to like to have certain procedures that are done at home, even by the pet owner. So what we need to do is we need to educate the pet owner on stress behavior as opposed to relaxed behavior, and so that they can create a fear-free environment in the home environment for their pets, as well as at your facility. So what's important is dogs and cats are always communicating. And I'm going to talk to you a little bit about how pets communicate with us. So one method that dogs and cats communicate with us is through vocalizations. And we're going to talk briefly about this. And there's 2 really essentially broad categories. with vocalizations. When we think about vocalizations, we have either distance increasing signals or distance decreasing signals. A distance increasing signal basically means go away. A distance decreasing signal means come closer. And when dogs bark, dogs can bark for many different reasons. But what can really tell us the difference about the motivation of the bark or the intent of the bark is the intonation. So a low pitch bark, a deep guttural bark or growl usually is a distance increasing signal. If the bark is high pitched, that usually is more attention seeking or an alert or excited type vocalization. And in a study looking at dogs and vocalizations, most pet owners were able to determine whether the vocalization indicated to go away, more of a threat type vocalization, or to come closer, like they're excited or they want your attention. When we think about cats, it's really the same, and we'll overly simplify it. Most cats who meow, meowing is an attention seeking behavior. In fact, cats are most likely to meow because it's a learned behavior and people often respond to them when they are meowing. But then hissing is usually a sign of fear. It can be a sign of aggression or defensive aggression, and it usually is a distance increasing signal. It's saying, I feel threatened by you and go away. So those are very easy, just two broad categories of vocalizations that can help to determine the motivation and the intent of our patients. Are they stressed or are they relaxed in different contexts or different situations? But dogs and cats will also communicate through olfactory or pheromones. And pheromones are chemical messages that are species specific and change the behavior of the receiver. And so we have two broad categories of pheromones. We have calming pheromones. You can think about adaptal, dog appeasing pheromone, or feel away. And so those are calming pheromones that are designed to reduce fear, anxiety, and stress. But we also have stress pheromones or fear related pheromones. And some of those may be anal sac secretion. So there actually is a paper that talks about dogs when they secreted their anal glands due to fear related behavior. Dogs could recognize that, and the way they interacted was very different than dogs when their anal sac expressions were because we expressed them in clinic. So they can recognize pheromones and they can recognize the fear or their anxiety associated with those pheromones. And they use that with communication. So pheromones can be really important and can change the behavior of pets. So we need to think about those and think about how those can contribute to fear, anxiety, and stress in your establishment. What we really want to focus on is body language. And dogs and cats communicate widely through body language. People aren't always really adept to reading body language. US Fear Free certified professionals should be. And we're going to review that some for you and try to help you to be able to explain this better to your clients. So when we're thinking about body language, really it's a picture. It's a moment in time. And we want to look at the total patient, the entire picture of the dog and cat. And we usually start at the head and we work our way to the tail, basically. That's the easiest. And when we're looking at the head, you're looking at the head and the position of the head relative to the top line. So is the head above the top line or below the top line? And then with the head, you're looking at facial expressions. And with those facial expressions, we're going to look at the eyes, we're going to look at the ears, as well as we're going to look at the mouth. And we're going to look at some examples in a few minutes. As we work our way back, we're going to look at the tail relative to the top line. So is the tail raised above the top line? Is the tail below the top line? Is the tail tucked close to the body? And then we're also going to look at body posture. So is the dog or cat leaning towards the individual or person? Is the dog leaning away? Is it standing tall and erect, high in the rear, high in the forequarters? Or is it low in the rear, low in the forequarters? Is the animal crouched? All those things, when we look at it together, can give us an idea of the motivation, or is the pet relaxed, or is the pet stressed? It's also really important that we evaluate body language relative to the context, because body language outside of context doesn't really tell us very much. So we need to know what's really going on. And that's why it can be difficult to evaluate body language with just pictures. But we are going to show you some pictures, and we're going to talk about the body language in those different contexts. So as fear-free certified professionals, you should be very familiar with these images, the images of a relaxed dog, as well as the image of a stressed dog. And so we're going to go through these. So we're looking at this relaxed dog. So we can assume this dog is relatively relaxed. but it's really hard to find a photograph of a relaxed dog because really a truly relaxed dog would be sleeping. Yet sometimes dogs will feign sleep. So just because they're sleeping doesn't mean that they're entirely relaxed. But let's start with looking at this dog's eyes. So the eyes look relatively neutral, relatively relaxed. The pupils don't appear overly dilated, which is an indicative of adrenaline surge or arousal. When we look at the ears, we have to assume that this dog's ears is normal for the breed or for the actual individual. If this dog had erect ears and the ears were down and towards the side, it may indicate the dog was a little bit anxious or a little bit uncomfortable. But then conversely, looking at the eyes, the dog's attentive, and looking at the commissures of the lips and the mouth is relatively relaxed, as well as this dog is panting, but the tongue looks very relaxed, and the head is above the level of the top line. The dog is curious. Now, in the picture, you can see that the dog is moving. The top line is fairly level. The dog's a little underset in the rear and a little bit high in the rear end, but those may be conformational differences. But then when we look at the tail appears to be wagging. It's out and it's away from the body. And what's really important is when you look at this picture is thinking about what happens next. So if this dog were to all of a sudden spook and bark at you and move away, well, obviously then that dog would be considered stressed. If this dog was really loosey-goosey, comfortable, came up to you, solicited attention, started licking you, we could say that dog is pretty comfortable and pretty relaxed. So again, a picture is a moment in time. What you really need to know is the next fixed action pattern and evaluate that relative also to vocal communication. So was there any vocal communication? Was the dog whining? Did the dog appear anxious? Or was he pacing entirely in the exam room? Because if the dog is pacing and inability to settle, usually that's not a dog that's relaxed. But we can greatly contrast the relaxed dog compared to the stressed dog. So when we look at this Cocker Spaniel and you look at his eyes, well, he's got dark pupils. You can't really tell, but likely there's pupil dilation that was going on there. When we look at the ears, a little bit difficult. This is a floppy ear dog, but we can kind of suggest that that right ear may be pulled a little bit further back, kind of tight towards the head. Now, when we really look at the eyebrows, there's some tension in the forehead, and there's some tension actually also in the mouth, where this dog actually looks like it's biting down on its lip. So it's a little bit stiff. But the overall picture, the dog is leaning away. It's lower in the rear than it is in the forequarters, and his tail is tucked close to the body. So it's very clear that the stressed dog is likely to move away. It's startled, it's spooked, it's worried, it's stressed. When we can compare that to the relaxed dog, who seems pretty limp, pretty intent, calm, soft mouth, overall a relaxed dog to a stressed dog. So now we're going to go through some different scenarios and some different pictures. And for some of these pictures, we know the context, and some of the other pictures are basically stock photographs, so we don't actually know the context or the situation. But let's look them over, and I want you guys to think about, as fear-free certified professionals, what is the motivation for the behavior? What is the dog ultimately communicating in this context or in this situation? So let's start with the eyes. So the eyes are slightly squinted. It's hard to tell if there's pupil dilation or not. When we look at the brow, it almost seems like the forehead or the brow is pulled slightly forward. This is what I would call a hard stare in dogs. I mean, he's looking at you pretty intently in this context or in this situation. And when we look at the ears, so the ears are off to the side, but they look like they're partially forward, that the dog probably was alert and interested in the individual that it was offering attention to. But then also it looks like the ears may be flattening back. And oftentimes when they're about to bark or when they're about to bite and lunge, they'll pin their ears back to the side of their head as a safety or defense mechanism so that they don't get injured. What really is a really clear indicator then is actually looking at the mouth. So we see the commissures of the lips are actually pulled forward, where you just see the incisors and you just see the canine teeth. And that is indicative of a more offensive type of aggression. So a more confident type of aggression. When you look at the tongue is pulled back and it's pretty rigid. Dogs will often pull their tongue back when they're about to snap or bite in order to protect the tongue. You don't want the tongue to get bitten. So when we look at the facial expressions in the mouth, suggesting a more offensive type of aggression. We can kind of see the top line. The top line is level. It doesn't appear that this dog is crouched. We can't see any evidence of piloerection, which would indicate an adrenaline surge, but the tail appears to be wagging and above the level of the top line. Because we can't see the tail actually wagging, and this is a fixed image, we can't determine if there's a left tail bias as opposed to a right tail bias. If this picture was indicative of the tail wag more to the right side of the dog, it may indicate that the dog doesn't have a negative emotional state or malicious intent, as opposed to a left tail wag. So that would potentially be the opposite of what his face is saying. But pretty confidently, I could say that this dog is showing offensive aggression. It's not one that you want to mess with too lightly. Obviously, there's some fear, anxiety, and stress on FAS level 5 is what I'd picture this dog as. But again, we'd like to know vocalizations. Is it a deep intonation bark? Is it a low pitch bark? It's a stay away cue, right? That would be helpful. And if there was any anal sac expressions, that would give you information too as well, indicating fear or arousal. Okay, now let's look at this dog. Now this dog, I was actually on the receiving end of the camera. This was Debbie's dog, and we're actually set up a photo shoot for her. And if you look at her eyes, you do see that she is aroused. There is pretty clear pupil dilation. Her ears are up and her ears are alert. Her face over in her brow doesn't offer too much tension, I wouldn't say. But when you look at her mouth, the cheek teeth are exposed. The commissures of lips are pulled pretty back. Her tongue, for the most part, is pretty relaxed. It's over her lower incisors. And what I can tell you in this picture is that it's hard to tell, but the dog was laying down. Her tail was wagging actually during the photo shoot. And this dog was actually focusing on a tennis ball. And so she was cued to bark. And so she may have been a little bit frustrated, but she wanted her treats. She wanted her ball in that context. And she wasn't showing an aggressive intent. Now, if there was a left bias tail wag, that may indicate a negative emotional state. Again, you can't tell with the picture. You would see that the tail would be wagging more to the dog's left side as opposed to the dog's right side. And that can give you some indicative of the intent of the dog or the motivation for the behavior, a negative emotional state as opposed to a more positive or affiliative emotional state. Now, the last picture, we have a similar breed. You're looking at the eyes are a little bit squinted. The pupils are constricted, but that may be the sun is in this dog's eyes. The ears are pinned back pretty tight, but the commissures of the lips are pulled back. You can see all the cheek teeth, and the tongue is exposed pretty extensively. Obviously, this dog is panting. You can see there's a lot of salivation. There's a lot of drooling. What I would expect is that this dog is stressed, but it's heat stressed. So this dog is panting probably due to heat stress. So when we look at all of these photographs and all of these images, they're very, very similar, but they're also very, very different. And so we don't look at just one body part, we look at all body parts. And we also want to try to incorporate, well, what happens next? That's really important. What does the dog do next to determine what the ultimate motivation is? Think about olfactory communication, as well as think about vocal communication and the intonation of barks, or is there any vocalization, or is there just heavy breathing in the case of the dog on the right. So we have to get clients to be able to understand dog body language and be able to understand what is a relaxed pet as opposed to what is a stressed pet. So how do you do that? How do you do it easily when you're so busy in everyday appointments and consults that it's hard to convey over that information? Well, very easily, you share a fear-free link with their clients about dog body language so they can understand what dogs are saying. There's a link at the bottom of this actual page, and I'm going to read it to you. It's fearfree-homes.com/courses/dog-body-language-101. And so sending your clients this fear-free link, which is free, is invaluable to teach clients how to understand if their pet is stressed or is their pet relaxed. The video is about 4 to 5 minutes long. We're only going to show you the first part for time.
Hey there. We dogs communicate a lot of information with our body movements and facial expressions. Sure, we might bark, yip, howl, or growl, but our main way of talking to you through nonverbal signaling. That's why I want you to be one of those people who can communicate with animals by reading our body language. When we are just chilling, we put on our neutral and relaxed pose. Our ears are in their natural position. Mine are floppy, and hers stick up, but aren't perked forward when she's chillaxing. Our eyes are soft, and we aren't looking nervously in another direction, making the whites of our eyes show. We carry our tails in their natural state.
Okay, so similar with cat body language. You guys are familiar with these images of a relaxed cat as opposed to a stressed cat. Looking at the cat on the left, the cat is attentive. It's looking forward. Its whiskers are pushed forward, relaxed facial expressions. The ears are forward and erect. But the cat is laying on its side. It's rotated on its hips. Its forelegs are extended away from its body, and its tail is out and relaxed, and ideally still, not wagging. So that's a relaxed cat. Conversely, the stressed cat, ears are pinned back tight to the side of the head. Pupils are dilated. The eyes are squinting. The nose is wrinkled. You see the teeth exposed. Whiskers are actually pulled forward. The cat tongue looks like it's probably hissing in that context. Overall body language, the forelegs and rear legs are underneath the body. The back top and top line is arched. The cat is actually leaning away, and the tail is tucked tight to the body. So those are all indicative of a stressed cat in those situations. Now, I want you to think about with these two Siamese kittens, which one is the more relaxed cat as opposed to which one is the more stressed cat. So we have the seal point on the right and we have the silver point on the left. I'll give you a few moments to look at what are indicators that give you an idea to say one is more relaxed and one is more stressed than the other. Okay, so when we look at the cat on the left is more stressed. What you can see is you see pupil dilations. The eyes are more rounded than the cat on the right. The brow may be a little bit furrowed. When you look at the body and top line, the cat is in a contorted position, and the tail actually isn't in line with the spine and is actually the opposite side that you would expect it to be with the way the cat is turned. So that may give some indication that this tail is wagging. You can also look at the positions of the foot and that the foot is underneath. And I would expect this cat to run away, like it turned around startled and spooked, and it's likely to run away next. And that's conversely to the cat on the right, who looks pretty relaxed. His legs are extended away from his body, and he's rolled over on his hip. Similarly to dogs, we have fear-free, happy homes. Basically, you can access this link. And in this link, we can send this to our clients and help them to address and understand fear-free body language in cats. So again, it's a 4 to 5 minute video. We're just going to show you the tail end of the video here.
You now know what we look like when we are relaxed, happy, excited, and alert, as well as how we might communicate fear through fret or fidget, freeze, flight, or fight. When you know what to look for, you'll realize just how much we say to people on a daily basis. You'll be able to talk back to us in a way we understand and give us help when we need it.
You also have the spectrum of fear, anxiety, and stress. And so as fear-free professionals, you can download these from Fear-Free website. You can actually have them printed out. And what I'd recommend is to have them laminated and put them on the walls in your exam room, and where you can identify and document in the emotional medical record the patient's level of fear, anxiety, and stress from a level 0, a relaxed pet, to moderate signs or mild signs of fear, anxiety, and stress, and even severe signs of fear, anxiety, and stress in dogs. So documenting these in the emotional medical record allows you to, when you're doing a physical exam on our patients, to put out indicators of the animal's level of fear, anxiety, and stress. So now I'm going to transfer it over to Debbie.
Working on those transitions, going back and forth, trying to figure out the best way to do it so we weren't squished together the whole time. Thank you, Dr. Martin. That was a great overview of body language and how important it is for pet owners to be able to recognize what a relaxed pet and a stressed pet looks like, because they're going to miss a lot of the communication if they're not aware of what their animal is trying to say. So tip number 2 is going to be one that's really familiar to you as a fear-free professional. It's using a considerate approach, teaching owners what it is that we're doing that is making their animals respond differently to us. And that is using our considerate approach. Not only when we're thinking about our own body language, but also, probably even more importantly, in the home, is odors and smells and sounds that could make a pet more nervous or anxious. So, really thinking about what it is like to be a dog or cat and what kind of senses that they have that are different than our senses and what would make them nervous. We've learned all those things in the Fear Free program. Educating our pet owners about them is going to be just as important. So let's review a couple things that we can hit on. First of all, Dr. Martin alluded to this, is that things that can be threatening gestures to dogs and cats are direct eye contact. So if you're standing in line at Starbucks and you link eyes with someone, if they look at you for more than 1 or 2 seconds, you're going to start to get this kind of icky feeling, like maybe there's something wrong with you, or maybe there's something wrong with them. Why are they continuing to look at me? So certainly direct eye contact, prolonged direct eye contact can make us feel uncomfortable. Direct approach as well. Even with, Dr. Martin and I have a new puppy, a little 15-week-old border terrier who has stolen our hearts. And I've had to contain my enthusiasm at times when I want to interact with him because he's just so darn cute. But if I come rushing up to him to tell him how cute he is, sometimes I get that little deer in the headlights look, like, uh-oh, what's mom doing? Why is she coming at me? She's big and scary and I'm this little puppy. So I've had to remind myself that if I get down low and let him approach me, it's a much more fun interaction for him as well as for me, actually. It is fun. Getting back up off the floor sometimes is challenging, though. And then deep guttural tones. We want to think about the tone of voice that we're using, especially when we're doing training. I'll be talking about training a little bit later. But how do people politely greet each other, at least in North America, pre-pandemic? Well, oftentimes we're going to give direct eye contact. We're going to smile. I think dogs and cats have figured out that smiling is not us showing our teeth to them. They probably don't pay attention to our face that much, and their visual acuity at that distance is not that great. So at least in our field, we haven't found that many dogs or cats have been too upset about the mask that we've been wearing. So maybe it's because they don't really look at our mouth as much as we think. Interacting with people, I have found much more difficult. But we also tend to reach into the animal's personal space. And oftentimes pet owners think this is the way to interact with their own pet as well as unfamiliar pets. These are just stock images of people interacting with pets in ways that we always interact with them. And I would say if you have a really good relationship with the dog, that some of these interactions might be okay. The one down on the far right makes me a little bit nervous, but I don't know the context. Like maybe this is a trained behavior that this dog is doing and it's not actually as scary as it looks, but I don't know. Many dogs tolerate, and cats tolerate, the human interactions that we do, especially when they have a relationship with us and they trust us. But it's also important to recognize that we need to build that trust and maintain that trust by hearing what they're telling us and backing off when we need to. So teaching our pet owners about that is just as important. Here's an example of an owner looking at the cat. And where's the cat looking? Cat's looking straight down at its feet, almost to say, like, I don't really see you. I don't think this cat looks overly stressed in this image. But if we just change one thing, avoiding that direct eye contact, sometimes cats can be much more engaged and more interested and curious about interacting with us. So the things that you learned in your Fear-Free certification program are things that we want to teach pet owners, is that if they turn their body to the side, that can be less threatening for interactions. If they avoid prolonged direct eye contact. Now, there are some dogs and some cats that will stare lovingly back into your eyes. And I train my dogs to give me eye contact. And so it's been heavily reinforced. And there are things that you can train your dog to enjoy. I like to hug my dogs. So I try to teach them early on a cue for hugs, and I let them initiate it and I reinforce it. So I get my human needs met without forcing it upon them at all times. We also want to think about moving smoothly and calmly, especially if the dog or cat seems nervous or anxious. Letting pet owners know if they just take a deep breath and relax, oftentimes that will help the pet relax too in the home setting. Talking slowly and softly, slowing ourselves down when we're interacting with pets in the hospital, but also coaching owners on doing the exact same thing. Just like people, we can feed off the energy around us, and dogs and cats are no different. Iris, a little beagle Jack Russell that Dr. Martin and I used to have, she was very in tune to our tone of voice. And if we would get even just excited, it didn't have to be a disagreement or argument or anything like that. If we would get excited about something and would get passionate talking about it and kind of agitated in our discussion, she would get nervous and she would go outside or go to the door and pull up the door, kind of like, I want to go somewhere else, or she'd leave the room. So she was a little bit of our kind of canary or bird to let us know if our tone of voice was becoming more animated or too passionate about certain things. Also, we want to allow the pet to approach. I said how I'm doing that with my own puppy now is I'm getting down on the ground, letting him come to me instead of me jumping in and giving him kisses and loves and picking him up all the time. I still do it a little bit. I can't help it, but it works much better. And he seems to enjoy it much better when I let him choose to approach by getting myself down low and letting him come to me. And then using treats. Instead of feeding food at meal times all the time, if we're home and interacting with the pet, we can reinforce behaviors that we like all the time and make those behaviors more likely to happen in the future. And then avoiding aversive scents and using calming ones. In the home, this is particularly important too, because if we think about it, really honestly, pets spend a very small proportion of their life at the vet hospital. And all the great efforts that you can put forward can be undermined by living in a home that has negatives around it, things that are overpowering, smells that are damaging for the pet emotionally. So being aware of the things that we're wearing and coaching owners on that is going to be just as important. Tip number 3, meeting the pet's social, exploratory, and physical needs. This is really important too. Coming up with 5 tips was actually pretty challenging. So we made them into big tips that include a lot of information. So this is enrichment we're talking about, enriching the animal's life. Exploratory options are things like foraging activities, the find it game where we teach the cat or dog to search for food on cue, or food puzzle toys, allowing them to eat out of a snuffle mat or a Kong with canned dog food frozen in it or canned cat food in it. When you have multiple pet households, it's important to be careful about doing foraging activities if all the animals are around each other, because there could be some competition. I kind of think about this like the Easter egg hunt with kids, when you put the Easter eggs, plastic eggs out, and everyone has to go find them and they have gifts in them. People are now doing things like they're color coded. Each kid has their own color coded one so they could prevent the arguments and the rushing around and frantic nature of it. Same thing with dogs and cats. If there's competition or multiple pets in the house, it's better to give them their own space to do the foraging activities. Rotating toys to maintain novelty, having a closet full of toys. Don't have to keep getting new toys, although that's fun too, but you take some out and you put some away each day so that you're rotating the toys in and out, and that maintains their novelty. Taking dogs and harness trained cats perhaps for a sniff walk. This isn't about endurance exercise. This is more about smelling the roses, going out and letting them smell things and kind of read the pea mail. If you can have safe outdoor exploration for a cat, like a catio, that's a really nice option to give them some enrichment. You can also bring some things in from outside if your cat likes novelty and you want to bring in safe branches or grasses for them to explore and smell. Increased vertical living space for cats is really important too. Allowing them to use 3-dimensional space gives them increased square footage in the household. So here's some exploration ideas for cats. This one is a cat grass that you can grow, and you can actually put their food, if like a kibble food, in that, and then they have to search around for it. And then the one on the left is like this amazing cat enclosure that was built, that the cats have a tunnel that comes from the house to this enclosure. Now, you don't have to get that crazy and spend that much money, but having some kind of enrichment is going to be important, especially for house cats. And then when we think about some physical and social activities, actually, this is an exploration activity as well. Short walks on leash. So we're talking 5 to 10 minutes. I'm not talking about taking the dog out for an hour, 2-hour walk and wearing them out. It's really about engaging with the pet out on walks and taking treats with you so you can reinforce desired behavior, and engage with the dog. Put that cell phone away. It can hold off till later. Explore things together and have a great time. It's great for you and it's great for the dog. And that old mantra, a tired pet's a good pet, I don't really believe in that. We at one point had 3 Belgian Malinois in our household, young Belgian Malinois, and you really don't have to exercise them to exhaustion, because then you're just creating a marathon runner that needs more and more activity. And nobody has 4 hours a day to walk their dog or wear them out or play Frisbee with them. So short walks are fine. It's the exploration. You want to mentally exhaust them, not necessarily physically exhaust them. So we want to provide enrichment. An enriched pet is a good pet. Other things that can be physical and social activities, and one that's really important, is social play with the owner. This is relationship development. Chip and I, our new puppy, we spend a lot of time playing with toys. Well, he's chewing a lot right now because he's teething, but playing with toys is really important to develop a relationship with me and how we should play together. Tug with rules, and then wand like toys for kittens. So I'm going to show a short video of playing with a puppy.
This video demonstrates inappropriate and appropriate play with a puppy. Wrestling with our dogs can be fun, but it can be problematic if the puppy gets too excited and causes injury. Not everyone appreciates a puppy jumping on them and snapping at their face. It is important for puppy owners to decide what will be safe and appropriate play in their house from the beginning, so the puppy learns the desired behavior early. Ultimately, it is probably better to teach a puppy to play with us with toys rather than biting at our hair and face. Notice how the person keeps the tug toy low to the ground to prevent jumping, and she gives gentle tugs on the toy from side to side and lets the puppy win the toy. This makes for a calm and fun game together.
A lot of people ask and think that actually dogs need to play with other dogs. And some dogs do really enjoy going to the dog park or going to doggy daycare. Usually these are younger dogs that really do well when they're around other dogs. They defer to them. So if things get tense, they're like, oh man, I didn't mean to get in your face. I'll back off now. And they can really adapt their play appropriately. But a lot of dogs don't enjoy going to the bar scene all the time and meeting new dogs, and just like kind of with people, as they start to grow up and they become more mature, that may not be as appealing for them. So it can change as they go through developmental stages. In fact, I mean, we've domesticated dogs, and some research actually indicates when given the choice, dogs prefer the company of people versus other dogs in a lot of situations. So it's not a need for all animals. We get that a lot with our clients that come in. They think that their dog must go to a dog park or to doggy daycare and play and be social with other dogs. Otherwise, they're not really fulfilling being a dog. And that's not necessarily true. Finding what your individual dog likes or your client's individual dog likes is a little bit of detective work and has to be fostered at a young age and can change as they develop as well. Other things that we can do for physical and social activities are positive reinforcement training. Learning should always be fun. If you're afraid to give the answer because you might get corrected or punished, that makes learning a little scary. So no need for verbal corrections or wrong signals. We can create a positive environment so that the animal's not afraid to be creative and learn with us. Creating a routine provides consistency and predictability, and that can decrease stress. If the animal knows what's going to happen next and they think it's going to be good for them and all their needs are going to get met, then they're going to be more relaxed just in general. Just like us, like if our day goes as planned, things are great. How often in veterinary medicine do the days go as planned? Not very often. We have a very stressful job in general. But some components of a routine for pet owners and their dogs and cats would be having routine walks and or play sessions, training sessions, and setting up exploratory activities, 2 or 3 exploratory activities every day. Usually I tell people if they're feeding their pet routinely twice a day, that you lump those activities in before mealtime, so that it's called habit stacking. If they're already doing something twice a day and we want to incorporate something else, we just start to add these in before that other activity, the mealtime. Environmental management is going to be important too, and this helps create a safe environment for the pet, and also helps create preventing them from learning things we don't want them to. So cat and dog proofing the house, controlling the learning history, because if they have opportunities to chew on furniture you don't want them to chew on, then that's going to become a habit. Our toilet paper right now is sitting behind the toilet as opposed to on the roller, because Chip has found the toilet paper, and when he gets the opportunity to go in there, he checks to see if there is any toilet paper on the roll at the time. Blocking access to certain areas can be important as well, so that they're not getting into things that we don't want them to. Confinement training for dogs and cats is really important. I really like to have cats comfortable being confined, and usually I use a multi-level cat cage for that. There's a variety of reasons that that can be very important. Hiding spots for cats as well, and then supervision, especially if it's a new pet that they've just adopted. Really need to keep an eye on them to help with the house training and also help them be successful. I tell people if there's something that they just couldn't live without, or they'd be really upset if the dog or cat broke it or chewed on it or scratched it, it needs to go away, at least temporarily, until you have a better feel for the pet in the household, or they've developed into adulthood and they can be a little bit more trusted. So environmental management is going to flow right into tip number 4, and that is avoid reprimands and adversives and use redirection and rewards instead. Well, this flows perfectly with fear-free concepts, right? We are trying to decrease fear, anxiety, and stress, but oftentimes people think, well, you know, that's great in the veterinary field or when we're doing husbandry care, but this is training. And so it's different. It's not different. Everything's training, and the animal's always learning. And how we respond to things is very important. And helping owners learn the importance of this is going to be critical in creating that fear-free, happy home for the pets. What are problems with using aversive reprimands? Well, one, it inhibits learning altogether. It works. It inhibits behavior. They wouldn't continue to use aversive training techniques if it didn't work. But it reduces creativity and induces fear, anxiety, or conflict, and it withers away the animal's trust in us. It can damage that human-animal bond or relationship that we have, and it increases risk of injury to owners, because fear and anxiety can roll into aggression if the animal is feeling threatened in a certain context, or aversives, or even just verbal reprimands are being used, or a threat of punishment is being used. So oftentimes people, as well as animals, will defensively fight back to keep themselves safe. It's also inappropriate for teaching new behaviors. Like I mentioned earlier, learning should be fun. It should be fun for us as a trainer, and then also fun for the animal. It's inappropriate for addressing behavior problems because it doesn't get at the root of the motivation or appeasing that motivation. That the animal wants to chew on something hard or scratch on the couch surface. We need to give them an appropriate outlet for that, as opposed to just wanting to reprimand them for it. Alternatives to aversive. So you're probably thinking, Debbie, well, what am I supposed to do if my dog's chewing on the couch? I'm not supposed to reprimand him or tell him no? Well, we're going to use environmental management to make sure that we're setting them up to be successful so they're less likely to make the wrong choice and more likely to make the right choices. And then we can teach an alternate behavior. So, for example, if I see Chip chewing on something that I don't want him to be chewing on, I just simply make a kissy kissy sound, clap my hands, call him away, and then I give him a alternative toy that is similar to whatever he was chewing on. If it was something hard, I'm going to give him a hard toy. If it was something soft, I'm going to give him a soft toy. I'm going to funnel that behavior into a human approved activity. And the cartoon kind of says it all right there. And I love Dr. Susan Friedman's infographic. You can get this at behaviorworks.org, but it really looks at when we're thinking about behaviors and when we are concerned about something, we need to think about these exits. And you start first at looking at the health and well-being of the pet. Is their nutrition good? Are they physically sound? Is there a medical condition that could be causing this behavior? And then if we've ruled that out, then we want to look at environmental management, the antecedent arrangements. Have we set the stage for the animal to be successful? Or have we just kind of hoped that they'd make the right choice? And then the third exit is using positive reinforcement, reinforcing things we want to see in the future, because the more we reinforce it, the more likely that behavior is to happen in the future. And then exit 4, you see there's a little speed bump right before you get to exit 4. And that's because if we've gotten to exit 4, it means the dog or cat's already performed the undesirable behavior and we haven't set the environment up appropriately or reinforced or redirected appropriately. So differential reinforcement of alternate behavior is this redirection that we have to do when the animal's in the moment. And then the following steps you see: extra speed bump, yield sign. These are more likely to do damage to the relationship that the pet has with the pet owner. For more information, if you want to learn more about dogs, this is Puppy Start Right. Dr. Martin and I wrote this book, and that's Ileana on the front, and she is almost 14. She'll be 14 in September, and she's been helping little Chip learn about how to be around senior dogs and done a great job with him so far. So I'm going to turn it back over to Dr. Martin and talk about our last tip.
Okay, now tip number 5. So how are we going to teach the pet owner how to utilize fear-free techniques with giving care at home as well as at the veterinary hospital? Well, we got to realize that every experience is a memory. Dogs and cats are always learning. They're learning good things and they're learning bad things, and they're making associations. And what you want to think about is with associations is that they could be pleasant, they could be neutral, like I'm indifferent. I don't really care about it so much, it's not that important to me. Or they can be unpleasant. So what we're really worried about is unpleasant associations that are being made. And unfortunately, dogs and cats often have unpleasant or negative associations with the veterinary hospital or with veterinary care or routine procedures even done by the pet owner. So the dog may make association when it sees its leash that it's going to go on a walk and be excited. The cat may make an association when it sees the brush that it's going to get groomed and it likes being groomed. Those are pleasant associations. But unfortunately, with the veterinary hospital, sights, sounds, smells, the white lab coat, the injection about to happen, seeing the stethoscope about to be restrained, all those things are negative emotions, and they're taxing on the relationship that we have with our pets, as well as the relationship that the pet owner has with them at home when trying to apply care. So we need to try to educate pet owners on using fear-free techniques and using treats liberally, as we would be using them in the veterinary hospital, for them also to be using them at home when implementing care to their pets. So we need to teach owners how to use a considerate approach and gentle control techniques, because there was a study that looked at owner reprimands in dogs, and owners who reprimanded their pets for refusing care at home, they were more likely to have animals who would display aggression towards veterinary professionals. So at home, without using fear-free techniques, they can undo all the good we do as fear-free certified professionals and make life really difficult for us. And unfortunately, a bad experience for the pet. So what we want to do is try to teach pet owners how to avoid these things, how to make them positive. And as veterinarians and veterinary professionals, we can't just explain to the client, okay, this is a treatment for a procedure. Your dog has otitis externa. It has an ear infection. Here's a medication. Here's how I want you to administer it. I want you to give it to the patient twice a day. We need to teach the client also what are fear-free techniques that could be used with administering that care, so that we're not doing harm to our patients, so that we are using treats liberally. Is the patient taking treats or taking reinforcement? That can be invaluable to assessing the fear, anxiety, and stress scale, and then using gentle control and a considerate approach type techniques. We know there are predictable causes of fear, anxiety, and stress in dogs and cats. Some of those may be a change in routine. So the dog or cat that is fasted or that is hungry, well, just like us, they may be more likely to be hangry and get anxious in certain contexts or situations. If the owner is nervous or if the owner is anxious, that can influence the behavior of our pets. Dogs are known to social reference, and they look to our behavior and depending on if we're comfortable and relaxed or if we're anxious and afraid, they're going to mimic those behaviors too as well. And there was a study looking at children about to receive vaccinations, and the behavior of the parents dramatically influenced the behavior of the children. When parents were anxious, nervous, or concerned, or you're okay, you're fine, it's not going to be so bad, the actual children were much more worried about getting vaccines than when they were not. And so that likely applies to our dogs and cats getting veterinary care too as well. So I want to be relatively calm, nonchalant, and rather than just saying, well, don't reinforce that behavior, it's important to get owners to do things like administering treats, bringing the pet's favorite treats, being proactive. We want to foster positive emotional responses rather than neutral or negative ones. A lot of times in the veterinary hospital, we know there's unfamiliar sights, sounds, smells, people, and animals, and all those things are predictable causes of fear, anxiety, and stress. The car travel may be stress-inducing. How common is it for you take the carrier out for the cat and the cat's running and they have to cancel their appointment? For dogs too as well. So for dogs that were only taken to the veterinary hospital in the car, that's the only time they rode in the car was to go to the veterinary hospital. Those dogs were more likely to have travel anxiety than dogs that were taken to the car and taken to other places. And then the absence of owners. So often with the pandemic right now, we have to give our dogs and cats away and can't be with them. And that has been stressful for a lot of my clients' pets, especially those pets that have separation anxiety that have just refused to leave the client's side. They're codependent, they're attached, and it can be really a significant cause of fear, anxiety, and stress. So how many of these things happen when a pet is brought in for a routine surgery, a routine dental, or routine diagnostic test? Well, just about all of them happen with an experience. So what we really need to realize is that pharmaceuticals and nutraceuticals are pre-visit pharmaceuticals, things that are used to reduce fear, anxiety, and stress. They should not be a last resort. Prevention is always easier than treatment. So we want to think about using these supplements, using these pharmaceuticals often. So when do we use them? Well, we use them based on the fear, anxiety, and stress score. So with our fear, anxiety, and stress score, if the patient has a low level of fear, anxiety, and stress, at a minimum, we're going to use a nutraceutical. We're going to use a nutraceutical. So one option would be to use Zilkene. Zilkene is a peptide that's found in milk. It's been shown in scientific evidence that it promotes calming, and it's extremely palatable for dogs and cats. Above all else, it's well tolerated. There's no side effects really with it. So we want to prevent it, anticipate that the procedure will produce fear, anxiety, and stress, and let's prevent it. It's rather that the patient not have a negative experience than the patient have a negative experience, because adrenaline consolidates memories and it makes it hard to forget. So you really should think about using pre-visit pharmaceuticals prior to every dental and every surgery that's about to happen in your hospital. And the reason for that is that if we do use PVPs, your induction dosage is going to be lower. Your actual inhalant anesthesia dose is likely to be lower. And so it's a win-win for the patient. It's a win-win for your hospital. It's a win-win for the pet owner. When we think about hospitalization and boarding, that is likely to be stressful for dogs and cats. And depending on the level of fear, anxiety, and stress, we'll determine if we're going to use a nutraceutical as opposed to a pharmaceutical. Radiology and other diagnostics like blood work are anticipated to induce fear, anxiety, and stress. So we should be thinking about PVPs based on what the anticipated level of fear, anxiety, and stress is, rather than waiting for fear, anxiety, stress to happen and then trying to address the problem. So really, PVPs are the pre-meds to procedures, as pre-anesthetics are the pre-meds to surgery. We don't wait for the animal to be in pain. We anticipate the level of pain with an ovary hysterectomy, a dog that's going to be spayed, a cat that's going to be neutered. And we give them pain meds as pre-meds. We give them pain meds oftentimes while they're under anesthesia, and we give them pain meds when they go home and are with their pet owner so that they recover a lot faster, because it's the right thing to do. Well, when we think about using pain meds, we need to also think about it's wrong to withhold pain meds to our patients. It's wrong to withhold anti-anxiety medications to our patients when the benefits greatly outweigh the risk. And so we want to give these medications prior to there is an adrenaline release. If you're afraid of flying and you took your Xanax right before taking off on the plane when you're already having the panic attack, it's not going to be very effective. Ideally, you would take your medication prior to going to the airport, prior to that anxiety building as you're about to board the plane and the plane's about to take off, because it's much more effective as preventing fear, anxiety, and stress, or a panic type situation, than it is to reverse those changes once they've already occurred. So here I'm going to turn it over to Debbie to conclude it.
Yeah, well, we can just stay right here together. So we went through 5 tips to help pet owners really get off on the right paw with their dog or cat as they're coming to your hospital. And these are things that we want them to kind of start to learn. We need to be educators for our clients, just as we're educating them about the health issues that that their pet can have and what we're preventing. We also want to prevent the behavior issues that can often result in a pet being relinquished. So recognizing body language indicators of relaxed and stressed pets, teaching owners about using a considerate approach, meeting the pet's social, exploratory, and physical needs. And that's going to be individual. Certainly a senior dog may not need as much activity as a young pup. Avoid reprimands and aversives, use redirections and rewards instead. And then utilize those fear-free techniques with giving care. Start to set the stage right away that PVPs are something that we use in our hospital, that we care about your pet's emotional well-being, and we can't communicate to them what we're about to do or why they're being dropped off at your hospital. And so the PVPs, the nutraceuticals or the pharmaceuticals can really help that be a smooth transition and prevent that fear and anxiety and stress from ramping up. Some resources for you. You probably all know fearfreepets.com already, but Fear Free Happy Homes, if you haven't checked it out, amazing. There's over 60 some video tutorials, maybe up to 75 or 80 now. And then there's also blogs and handouts and resources for pet owners.
Free for the pet owner.
Yeah, it's all free. So, and then Puppy Start Right, our little plug for our book there. But you can also find a Puppy Start Right preschool puppy class in your area. So we do have a locator map on that website there. And then if you want to contact us individually, we're going to get to questions. But if for some reason we can't answer all the questions today, you can always send us an email at info@veterinarybehavior.com. We promise we'll answer your email. It might take us a day or two, but we will answer it. And one last Fear-Free Happy Homes plug. And we want to thank Vetoquinol for being a sponsor of Fear-Free, but also sponsoring this presentation for us. Okay, well, let's turn it over to questions. We'll get back to Stacy.
All right. Thank you so much, Debbie and Dr. Martin, for those tips for our new pet owners. We do have a few questions from tonight's audience.
Excellent.
So the first one that I'm looking at here is one that I actually saw come through quite a bit. When we have pets that aren't food motivated at all, how do we help? For this situation, it's somebody who's administering sub-Q fluids and medication to a cat. The cat has no food motivation. How can they help them be less stressed when they see the oral syringe or the fluid bag set up?
Yeah, I'll answer that one. For the most part, dogs and cats are not stress eaters. So where people during the pandemic, when we're stressed and they're anxious, sometimes you turn to comfort food, right? And you eat more. You have the opposite where, sometimes when you're stressed or you're depressed, you're going to eat less. But people, sometimes there's variability. Dogs and cats, they're not stress eaters. So when they're stressed, they're going to have inappetence. And so really then thinking about addressing the stress related factors is going to be the most important thing. So what is the cause of stress? Evaluate the fear, anxiety, and stress scale, and then use PVPs. And there are PVPs that we can consider using that may actually help with appetite as well as anxiety. I mean, one is mirtazapine. Mirtazapine is an anti-anxiety medicine, an appetite stimulant, and an anti-nausea medication. So that could be considered used for multiple. And then for cats, there is Mirataz, the actual transdermal that's FDA approved for inappetence in cats. So you could consider using something like that. The other thing we sometimes consider using in our patients, and my patients particularly, are benzodiazepines then. Now you need to be cautious. Diazepam in cats potentially can cause hepatic necrosis. So we don't ever use oral diazepam in cats as a general rule because of a couple published studies on it. Maybe safer would be lorazepam or some other benzodiazepines. Even some people use alprazolam, which is the generic of Xanax, which is used to treat panic attacks. But side effects of those medications can be increase in appetite. And then you have ciprofloxacin, which has been used as an appetite stimulant in cats. It probably does have some anxiolytic effect too as well. So those are options about PVPs that you could use. Other things, sometimes we can increase the palatability of the food. And so ways to do that are thinking about things like Fortiflora. We use Zilkine is the other one. And those are the two top ones that I use in cats. Is going to be, I'm going to do it when I'm trying to give cats medications and they won't take medication, something like an SSRI. I think about, I oftentimes have a Zilkine capsule, sprinkle it on the food. I've had feral cats that people couldn't touch. We couldn't get them to take the oral medication. We sprinkled Zilkine on top of it and they gobbled it right up, and it got them jump started with taking the conventional medication when we need something more than a nutraceutical. And then Fortiflora or Calming Care supplements, those things are really palatable. It's kind of like the powdered sugar on the beignet donut that makes it a little better, or it's the icing on the cake. So we can use those things to make them more palatable. And then with dogs, sometimes we think about if we're using the regular kibble in different contexts, getting a little bit of Parmesan cheese or some bacon bits and put in a Ziploc bag and kind of shake and bake. And so it absorbs the flavors, or taking a little bit of freeze-dried liver and put it in, mixing it with the kibble to make it more valuable in different contexts. So you have to use really high valuable treats. You got to find what the cat likes. And you should have that in your emotional record, saying like, this is the most preferred as far as the least preferred, and then assess the fear, anxiety, stress, and you need a higher value treat in that context. But medication oftentimes is important.
Yeah. And I was going to add too is that a lot of cats haven't learned to eat around people or to take food from people. It really is a learned behavior. I actually learned this from Jasmine, our dog that we got she was 8.5 weeks old, but she hadn't been trained much by the breeder. And when I went to train her for the first time, she wouldn't take food out of my hand. She just looked at it like, that's weird. So I placed it in her food bowl and she ate it out of there. That was the only context that she knew where food came from. So cats, oftentimes, if owners haven't trained them, they don't know that people can be givers of good things. So that can be important to teach before we actually try to use it in husbandry care. But then we can also find other things that the cat likes or the dog likes. If they're not treat motivated in the moment, sometimes they like a nice rub behind the ears or between the right over the brow there or along the side. So finding a calming touch that can be reinforcing for them, especially if it's someone the cat is comfortable with, because even though the owner might get away with that, you might not. If the cat doesn't have a relationship, it's kind of like with people. If a stranger came up to you and started touching you, you might be like, oh, that's weird. But if you have an established relationship, it might be acceptable depending on the context. Not always is a massage something that you want if
Right.
you're concentrating on something, right? So thinking about different things that could be reinforcing, and toys or play can be another one. And sweet talk sometimes can be nice too, as long as it's not only done when something scary is about to happen, right?
And Dr. Marty Becker, I think when he talks about Cool Whip, so like, whipped
Yeah,
cream, basically.
whipped
Whipped cream, what bonita flakes, shrimp,
Shrimp,
and
green olives. I
green
haven't
olives.
found a cat that likes green olives yet, though.
and then the chimichurri.
tried.
Who is it? No, not chimichurri.
Chim-
It's churri.
Churra.
What is it
Yeah,
called?
churra. I think it's
I always get it
churra.
wrong. It's not chimichurri.
I'm actually using it for
It's a
Chip at his vaccines.
it's
cat
a
treat.
Japanese treat, basically.
I have it. I
You can
have
find
it.
on Amazon.
Yes. Churra. Yeah.
Love all these
Churra,
tips.
there you go.
Churra,
So
yeah.
good.
Churra. Yeah,
Churra.
that's what it is.
Tuna works too.
Sorry.
Yeah. Churra.
All right. So the next question that we have here, cats chewing on electrical cords. What type of toys or how do we redirect behavior that way?
You want to handle that one's management avoidance?
Yeah, sure. So some of it is setting up the environment, right? So if we have a known chewer, then we need to make sure, one, that we have protection over those electrical cords, or we block access to that area if possible. So certainly going to your store, going to a home store and getting those kind of covers that you can put over them. But in a situation like that, if you see the cat going to chew on it, then redirection is important, right? We want to get their attention, call them away. Teaching them a come cue is really important. I think the two behaviors that I really want cats to know is a come, and then also a go to your spot, go away from me. So I can send you away, or I can call you to me, whichever I need to do in the moment. And we train those with food or treats or attention or whatever the cat really likes. And then we have a reliable way to communicate to them when we need them to stop doing something. We tell them what we want them to do instead. Ideally, you catch them before they start to chew on it. Like if you see them going over, that's a good time. Don't hold your breath and wait to see. Yeah, so interrupt, redirect, and reward in that moment before they make the wrong choice. Make sure that we've got plenty of novel objects for them to chew on and explore. Oftentimes when they start kind of getting into trouble, it's because they're bored. They're looking for something to chew on. And sometimes the cats and dogs will learn that if they do this, my owner can't ignore that. And so they will learn to do those behaviors to get your attention. Try to clock, when is it happening? Is it a certain time of day? Can we preempt it with some other enriching activity? Make sure we have good routine that is meeting the cats and dogs, social, exploratory, and physical needs.
So in kittens, puppies, it's probably exploratory behavior. But with adult cats, or adult dogs, it may be associated with anxiety, generalized anxiety. So that would be a behavioral differential that you consider. Cats that are excessive chewers or dogs that are excessive chewers. If it's not adolescent associated behavior, it could be an anxiety-related behavior, and then it also could be a medical condition. So you want to look at, dental health, and GI disease, GI disorders, especially with pica. Chewing things, swallowing things inappropriately, anxiety-related condition. So sometimes we have to think. And sometimes they're multifactorial, but really you always start with identifying, avoiding the practice of behavior, management, supervision, alternative outlets for it. And then if that doesn't address it, or you see other behavioral indicators, looking at body language, looking at vocalizations, look at owner-pet interactions, and you think there's an anxiety-related component, then we think about treating the anxiety-related component concurrently.
And the reason we don't use reprimands in that context is because it just teaches the animal to do it when we're not around, so they can learn safe and unsafe. They don't really learn right and wrong. They learn it's safe to do it when my owner's not in the room, but it's unsafe to do it when they are in the room. And it just damages the trust that they have with us. So redirect them in a positive way, set up the environment so they're more successful, less likely to make the wrong choice, and address any underlying anxiety that could be there.
Or your puppies especially are just going to grab the thing and run away from you.
Yes.
And hide.
Yes, Dr. Merton, I keep telling him he needs to put his shoes up, and every day the puppy finds one of his shoes and proudly picks it up and runs out of the room with it.
He's all proud, holding his head high, shaking it. They're like, I got your shit tennis shoe. And it's like, all right, no, don't
We
make
gotta pick those
don't
up.
make a big deal of
No.
it. Let's go ahead and do an exchange and make it the lesser evil. I'd rather him grab my shoes and bring them to me like a little service dog, rather than grab
Run
them,
away.
grab them and run away. And yeah, so there's no chasing them with it. We're going to make it positive regardless. It's a lesser evil with just join a trade for it. Make them want to relinquish it to you. That's important for dogs as well as cats.
That's such a great tip there. I love that. So the next question we have here is taking us back to pharmaceuticals. This person in their practice, they have a lot of dogs that they're seeing with high anxiety, and they're not seeing trazodone be super effective. So could you review dosing for gabapentin, what is recommended for anxious dogs, and also for gabapentin in cats?
Situationally or just general anxiety would be my question.
Yeah. So I guess, so trazodone is primarily it's a serotonin antagonist reuptake inhibitor. With actual PRN dosing, it's probably more likely to have a sedation effect. It's primarily used in humans for insomnia, so it makes them sleepy. And obviously, if you're somewhat sleepy, you're going to be less reactive to things in the environment. Like there is going to be some anxiolytic effect if you're a little bit groggy and less sleepy. So well documented in dogs to promote that. Not as there is a paper on cats that showed improvement with veterinary visits. But trazodone isn't really my first go-to, especially on a PRN dosis for dogs and cats. But I do use it when I want a sedation effect, which is sometimes desirable in specific contexts, but not day in, day out. And if we're using it day in, day out, they usually do. You really get, after you use it routinely, you're getting a serotonin reuptake inhibition effect, which is actually more desirable without a sedation effect. So I don't use a lot of trazodone by itself. What I typically use is gabapentin combined with trazodone. For dogs, typically 5 mg per kg. 10 hours and 2 hours prior to the veterinary visit for trazodone. So I go lower doses on trazodone. What I find is when you try to do really, really high dosage, and the highest published dosage was 10 to 12 milligrams per kilogram PRN. When you do high dosages, you're just more likely to have side effects. And there are sometimes with trazodone, you can have paradoxical effects and increase irritability or anxiety. And then may lower the seizure threshold. So there's more risk a little bit with trazodone with other medications. So I tend to prefer gabapentin. Gabapentin in people is used for social fears, social anxieties, generalized anxiety. It's used for chronic pain type conditions like fibromyalgia. So it can be very effective at reducing fear, anxiety, and stress. The most common side effect is dose-related sedation or wobbliness. And that's really with the exorbitant high dosages like we use for fear-free when there's a level 4 or 5 FAS. A level 4 or 5 FAS, I'm going to use anywhere from 40 to 60 milligrams per kilogram given 10 hours and 2 hours prior to visits in dogs. If there's a lower level of fear, anxiety, and stress, I'm going to use the more conventional dosages, which is anywhere from 10 to 30 milligrams per kilogram. PO, 10 hours and 2 hours prior to veterinary visits. And sometimes we will work when we're using gabapentin routinely for something like generalized anxiety or social anxiety, or even chronic pain related conditions that contribute to impulse control or compulsive disorders. We will use a dosage of 10 to 30 milligrams per kilogram. BID to TID every 12 hours. Optimum dosing frequency is every 8 hours. Usually with trazodone, I find the optimum dosing frequency is every 8 hours. So you want about an 8-hour window between dosing. That's the 10 and the 2, essentially with it. So I use a lot of gabapentin combined with trazodone, and that's usually my first go-to for situational anxiety. If I'm going to use trazodone, and we test each of those medications independently by themselves at home in the absence of stress factors, and we have the client assess 2 hours later. Was the dog calmer, or was the cat calmer? Because if you test it with the veterinary hospital, was it the experience that pushed the pet over the edge, or was it the medicine that caused a paradoxical reaction and made the pet worse? And then sometimes I add clonidine to that. Clonidine is an alpha-2 agonist. It blocks noradrenaline. Gabapentin likely blocks glutamate. It really works on calcium channels. But it potentially it prevents glutamate or affects glutamate, the major excitatory neurotransmitter in the brain.
What if, so if it's not situational, if it's more generalized anxiety or chronic anxiety that the animal has at home. It's not just an acute event.
Mm-hmm.
Are you using just trazodone or just gabapentin?
No, so most of my patients that come and see me that have fear, anxiety, and stress in the veterinary hospital, and we're addressing that actual problem with behavior modification. Most of those patients, we're going to put them on a daily. They also have fear, anxiety, stress at home. Like, lo and behold, like, they're not just stressed in the veterinary hospital. If you see fear, anxiety, and stress in the veterinary hospital, you should question them. Do they have fear, anxiety, stress in the home with different contexts or other behavioral problems? Really, most of those patients are going to be started on an SSRI, usually once a day, orally with food, while we're working on behavioral modification at home. And then in addition to that, PRN, they may get gabapentin, or they may get trazodone, or they may get a combination of gabapentin, trazodone, and clonidine. I'll throw that in if I need to. And then sometimes we throw in benzodiazepines on top of that. It really depends on, we're going to test to see what works. We're going to give them some things that we expect at a dosage that we expect with tested dosages at home to know we don't have paradoxical reactions. And then we're going to build on that plan. And there's even some patients that have significant fear, anxiety, and stress, and a level 4, level 5, and they still need to be sedated. I mean, I probably see the worst of the worst patients. And so I use the analogy that any of us could have a colonoscopy done while we're wide awake. It's not that it's a pretty intrusive procedure, but it is probably very uncomfortable, but not that traumatic. You could be awake for it. But if you asked a person, do you want to have that procedure while you're awake, or would you rather have the good drugs that make you sleep and feel and not remember and not have a bad experience with it? I think any one of us would say, please give me medication. I don't want to remember it. I want to be knocked out for it. And if we asked our veterinary patients, I think most of them would say, yeah, I don't want to remember it. So it's not a failure to sedate dogs and cats for a veterinary procedure. Ideally, we work on behavioral modification so we don't need to. But the goal is to reduce fear, anxiety, and stress, and improve the welfare of our patients, as well as improve the welfare of the pet owners too, as well, and help them. In most of the cases, we can do that.
That was such a fantastic answer. I love that. That is all the time we have for questions tonight. So thank you again so much, Ken and Debbie, for being here with us and for all of the great information that you shared. Big thank you to Vetoquinol for sponsoring tonight's presentation, and thank you to everybody who joined us for tonight's webinar. So thank you guys so much for being with us tonight. Thank you for your time, and we will hopefully host you again for another webinar soon. So enjoy the rest of your night, guys. Take care.
Thank you for having us. Have a great night. Stay safe.